Are our quarantine measures and border control sufficient for a move to level 3?
Yes, absolutely. They're very, very rigorous. We have currently 1,601 individuals who are in facilities managed by the government. Some of those will be in the stricter version of quarantine, which means they can't leave at all because they're symptomatic. Others will be in facilities where they're able to get fresh air, but that's it.
And what about our health system? Is our health system able to cope?
Yes. I mean, I think one thing that will be clear to everyone is that the huge effort of all New Zealanders has meant that our health system absolutely has been able to cope. We've had ultimately, I think, 69 hospitalisations relative to our number of cases. That's been very low. It has been absolutely manageable, but that has been our goal. Our strategy has meant that everyone should be able to get the care they need no matter what, and we've managed to do that because of the strategy all New Zealand has adopted.
So can I just return to the topic of the app? So it sounds like now that's an optional thing, it's something you might not even go down the path of.
No, sorry if I haven't been clear.
Will it be formally considered at some point?
So, no, if I haven't, forgive me if I haven't been clear. The app is absolutely part of our work program, and work is underway, and it will be a feature of New Zealand's response. What I've said is that it won't be a part of the criteria around whether we move or not. And in large part, that's because an app will only ever supplement the work that we have to do for contact tracing. And again, most countries who have an app like this will highlight that you have to have the foundation of people and a people-centred network of contact tracers.
Can I ask about whether you have any update on how many cases there are where the source of infection is unknown? You mentioned a Wanganui case, I think.
Yes, so none today. I understand from yesterday one of the cases in Whanganui was source was unknown, and there was one from 2 or 3 days ago in Timaru, which is still being worked out. And then prior to that, we had done that analysis of all the outstanding cases that hadn't been linked from the 24th of March, and there was just all could be linked to cases in clusters except for 4 that had been put down to community transmission, and we're working with each of those public health units to not only continue to investigate, but also to ensure there is testing right around those cases to ensure there's no further spread.
Dr. Bloomfield, does it create any...
encouraging, surely that's a very low number.
It is encouraging, and I think particularly that just those 2 more recently, but what we're doing, for example, in the case of the Timaru man, even though there wasn't a list of, there weren't many close contacts, there's been quite wide testing, all of the folks in his workplace and various other close contacts. So we're sort of making sure that any case now, we're going in with a very thorough response, and we're working closely with the public health units, including wide testing.
And that's why part of that surveillance that Dr. Bloomfield's talked about, we're now attaching to actual cases as well. So. Timaru's an example, Whanganui another area, where as soon as we get that data, then using that to do some wider surveillance in that community to see if we can ascertain whether there has been wider undetected community transmission.
Target testing in Timaru.
Oh, yeah,
there has been already in Timaru, and Whanganui, from the lab data a couple of weeks ago, had quite low rates of testing. And so they've been doing much more testing in this last week, just generally across the population, and we're talking with them today about what sort of additional testing there might be needed to be done around that case, just to again make sure we're getting a really confident picture about whether there is wider community transmission or not.
And what a position to be in to be able to do that, knowing on individual cases to be able to respond like that, which is pretty unique to us right now.
Dr. Bloomfield, what medical procedures would be able to be carried out under level 3, and what is the situation with elective surgery and kind of catch-up work that would have to be done along in the wider health sector?
So in a sense, the principles that apply to the rest of New Zealand apply within the health sector, and that is moving from not doing much at all to doing whatever is being done safely, and that includes elective surgery and in particular urgent diagnostics and surgery for people whose care may have been deferred for a few weeks. So the key thing here is the principles are we're doing as much as possible while keeping staff and patients safe. And the DHB has been working very hard on how to make that happen as we go into Alert Level 3.
potentially give that a little bit more flexibility for that?
It certainly
and also,
will.
what is the pressure in terms of the backlog potentially of surgeries and that sort of
Oh, look, there's no doubt there will be a backlog. You will all know how busy our hospitals are in usual circumstances, and most of them have high occupancy rates. They are putting elective procedures through regularly. There's high demand on diagnostics. So there will be a build-up of care that needs to be delivered, and they're working on the plans to make sure they move through that as quickly as possible, prioritising those with the highest urgency.
on the levels coming down, presumably, how quickly
That's
that
right.
backlog will be cleared?
Yes, that's
Prime
correct.
Minister, you were saying our tracking and tracing is good, that our controls at the border are good, and that our health system is coping. So is that all four criteria met?
As I've said, jump to no conclusions. That is just a handful of the wider data analysis modelling and also wider societal and economic impacts that we'll be considering tomorrow. As you can imagine, this is an incredibly important decision for us to make. No one wants to lose the huge gains we've made as a country off the back of the hard work of every New Zealander, and so it'll be something that we will be giving a lot of consideration and will be moving cautiously.
How much weight are you giving to those economic concerns? Can you give a percent on how much weight you're...
No, look, I can't weight it in that way, but what we've always been really clear on is that our best response and our best recovery in terms of the economy will come off the back of being successful in fighting COVID. What we don't want in New Zealand is what you've seen in many countries around the world where they have prolonged periods of time with heavy levels of restriction. We moved hard and early so that we can move as quickly as we can back to as much normality as we can in everyday life, and that includes for our economy. Joe, I'll come to Joe first.
Just on contact tracing, in terms of people sort of keeping diaries, you've said that people's own information is best. As we look to potentially move to level 3 and people moving around more, are you asking people to be keeping sort of a written record of what they're actually doing?
It's not necessarily that it's best, but it's incredibly helpful. Yes, I would ask New Zealanders to think about doing that. Just keeping a quick note of where you've been and who you've been with will not only help them, it will help us. But if you imagine, even in asking someone 6 days later to recount every movement over a period of time, it's an incredibly hard task. Even it would be at alert level 3. And so I am asking New Zealanders to just have new practices, new things that they do at the end of the day, just to help us. Because the better that we are able to do at alert levels like that, the sooner we can move further down the alert levels, and the sooner life feels more normal.
I mean, will you be announcing your short-term media reforms or support package, and will that also include support for magazines who feel pretty aggrieved with being left out of publication during level 4?
Obviously, the best thing that we can do for those kind of outlets is get back into a position where they're able to publish, keeping in mind, of course, online offerings have been available and many have continued to work from home. The media package, I expect, will be in the coming days. But as you've heard us talking about, it's something that we've been working on actively over the past week.
Dr. Bloomfield, are you aware of a mental health staffer who's tested positive at Tauranga Hospital, and if so, what measures are being taken to contain the spread there amongst patients and staff?
Yes, I am aware, and I got a text 2 evenings ago from the Chief Executive there outlining a very robust and fulsome response to that. And I know the Medical Officer of Health and the staff in the unit have been working very hard on this over the last couple of days to effectively ring fence that, make sure there are no further admissions, test staff and inpatients very widely, and to provide other options for any new people who might require admission to be diverted to either whakatane or other DHBs.
Do you know roughly how many staff and other people connected with that case are self-isolating?
No, I don't know, but we can get that information.
Bloomfield, how concerned are you about that transmission within the hospitals that you mentioned? You said only a limited number had actually been transferred from patients. So is it really concerning then that we're seeing that sort of transmit between staff?
Well, I think the transmission between staff reflects the fact that, as we've found globally, a lot of the transmission happens when people are in close contact with each other, usually in the family home. And we know within the hospital setting too that colleagues are working close by. It's much harder for them to keep that physical distancing. And what it points to is the importance of making sure that all those measures are in place, physical distancing, but also really good hygiene, particularly hand washing, and availability and appropriate use of PPE. But it also emphasises, that even the best trained people using appropriate PPE is not fail-safe, and that's why we have this very low threshold for testing staff if they're symptomatic, and of course also for staff staying home and indicating if they have any respiratory symptoms and being tested, and then of course going in very hard with standing people down and testing all those who may have been close contacts.
Confidence in the processes that are in place to help keep those workers safe?
I am confident because I know that, and from my own time at a local district health board, that the infection prevention control specialists and the nurses there are very, very good at both identifying what needs to happen and also training staff in the right procedures. But as I say again, it's not always fail-safe, and that's why we need to have sort of those 3 or 4 layers of protection for staff.
Have you had an update from police at all since you laid out the potential changes to level 3, whether people have maybe heard first, second, third hand, not been completely on top of the news and think that those changes have already taken place? Are people being a little bit more liberal with their movements?
I haven't had a direct, any direct feedback on that. I do have the daily numbers, and so I'm happy to share them. There's been 371 breaches in the past 24 hours to 8 p.m. Yesterday. Overall, though, our numbers are at 321 prosecutions, 2,700 warnings, 76 youth referrals. Also important to note that we've had, of course, a number of prevention patrols. So between the 16th and 18th of April, 3,436 prevention patrols. I think it's probably hard for us to get a true sense because the police, I think, are probably where they think that there might be risk of drops in compliance up their patrols, and of course that means that they'll be issuing perhaps warnings more frequently if they're more present. Overall, though, the Google analysis that we have, which everyone can see is available and made available publicly, is actually New Zealand's compliance relative to other countries has been very, very high. So regardless of whether or not there's been perhaps some confusion, overall, New Zealand as a country has done exceptionally well with what has been a really, really rigorous approach that we've taken as part of our strategy as a country.
Prime Minister, a question from our sports team. The NRL has said that the Warriors have been granted some type of exemption to go over to Australia near the start of May. What's your understanding of this exemption?
Minister for Sport is perhaps somewhat ill-prepared to answer this question based on his attire, but he sits amongst you, and what I might get him to do is respond to that after the press conference. That's certainly not something I've been advised of. What I do know is that there has some thought has been given to different codes, how they'll operate once we get lower down in the alert system. Are there ways that we can create almost bubbles for teams that are in professional competitions to enable them to continue? But it feels to me like it's quite early days. With regard to the NRL, I'll leave it to the Minister for Sport to give you some more detail.
Can I just clarify those 6 cases you talked about before, the community transmission ones? There are about like 40 odd cases, the 3% of all cases that are community transmission. Does that mean the other 35, 36 odd are just a few cycles old and not of high concern?
Yes, so they predated the 24th of March. And again, of those 6, 4 have been categorised as community transmission, 2 are still under investigation.
Yeah. So we've been keeping a very close eye on this last 2-week period of transmission. So that's what we're monitoring very, very closely. Right in the front.
Dr. Bloomfield, I've had some concerns from Māori health practitioners that they don't have enough ethnicity data to help mobilise in Māori and Pacific communities. Do you have an update on the ethnicity data collection, and also in addition of the 912 recoveries, can you tell us how many are Māori and Pacific?
So if I go to the latter point first, I don't have the breakdown of those who've recovered. We do have the breakdown by ethnicity of all cases, and that is updated each day, and the latest figures will be on our website after this briefing. What I can also say is I think one of the concerns has been amongst Māori practitioners, and likewise we have Pacific practitioners who are advising us as well, that they wanted to be assured that both these groups were being tested, and particularly because we do know that in these sorts of events they tend to be groups that have poorer outcomes if they get infections in those communities. And so two things there. One is our rate of testing amongst those communities based on the updated data from last week shows over 15% of the tests are Māori. Testing has been done amongst Māori and about 8% amongst Pacific. So that's one thing. And the second thing is we are just we are complementing that with some focused testing, and particularly in some of those more rural Māori communities in Tairāwhiti and Taranaki. And actually on the Hauora Tairāwhiti website right at the moment, it talks about the testing that's going to happen over this next few days in a number of those remote communities on the east coast and further inland as well, just to help provide us with that assurance that we haven't got undetected COVID-19 in those key groups.
Okay, I'll take the last couple of questions.
Prime Minister, on the eve of the Cabinet decision tomorrow, how does it feel to have the option of lifting out of level 4 lockdown? Many countries around the world couldn't even fathom that at the point they're at.
I think that's a really good point. You know, I often reflect when I sit and talk with the Director General about an individual case, or when I talk about an individual person in hospital care, that we are still, despite battling COVID-19 ourselves, in a very privileged position to be able to talk about individuals. When I look overseas and see that some places they are tracking thousands a day. And so that does mean that we're lucky, but we're lucky because every New Zealander has joined us in a mission to get rid of COVID-19 in New Zealand.
Did you think we'd be in this position when you announced the lockdown 30 days ago?
You'll remember that at the time someone asked me whether or not I was afraid, and my answer to that was no, because we have a plan. But what everyone has proven is that we've been able to fulfil that plan because we've been in it together. And so I did think it was possible, and New Zealand has proved it.
A more difficult decision than the one you made to go into level 4?
I think every decision here has been difficult, not only because we're dealing with a virus that keeps teaching us new things, but also because we, in some ways, are doing things differently, and so it's not always possible to look to another country for examples. We are carving our own path here. So some of that does make it difficult, but I have confidence in the data we have, the analysis that we're providing, and the quality of the people that we're working with, that we'll make the right decision.
Prime Minister, Anzac Day is Saturday. I'm just wondering how you'll be preparing to celebrate a very unique type of day, and how you feel for the diggers that might have to do it a little bit differently this year.
Yeah, and we will have to do Anzac Day differently this year. But despite that, I hope that I hope that we will see even more participate in their own way because of it. I do think it will have a different feeling, and many have reflected on the fact that the huge sacrifices that generations before us have made at times when the international community has faced challenges that are frankly unprecedented. Our challenge is a different one, but I think it brings home exactly what it is that our forefathers have gone through. I hope that we'll see that recognition in people's own commemorations. I'll provide a little bit more detail next week on what it will mean for me and the government.
Bill, the CHT St Margaret's...
Last couple.
The CHT St Margaret's cluster, the residents there who were taken to hospital, how many of those residents who were taken to hospital have tested positive? And how many staff have also tested positive? And why were they taken to two separate hospitals?
My understanding is there are 6 residents who are in Waitakere Hospital, and they were all COVID-19 positive, and they were taken there to be cared for there. I don't think they were in 2 separate hospitals, but I stand to be corrected on that. And when I last spoke with the Chief Executive there a day or two ago, there were 5 staff members who were infected, and the other cases associated with that cluster are community-based, so family members of the staff members.
Okay. How concerning is the Ponganui case of a person in their 20s with no known links to the region's other 7 cases? And will instances like that play into your decision making on alert levels?
As we've talked about in these last 2 weeks, we have been getting down to analysing individual cases to see what they tell us about potential community transmission. And when we see that, doing follow-up to then test whether or not there is anything wider happening within those communities. But what I would say is this demonstrates also the job that our contact tracers have. They have to go in and conduct sometimes forensic interviews to try and ascertain what exactly has happened with a case that is a little bit more difficult to build a picture. But it gives you a sense of exactly what we'll be weighing up as a cabinet tomorrow.
One more on shopping centres. The New Zealand Retail Property Group saying that there should be a rethink on the opening of malls during level 3. They say centre managers can safely organise their operations to maintain social distancing. Would you reconsider malls?
No. In fact, retail all falls in the same category, whether or not they're a mall or a retail store on the main street of a small town. We're asking them to adopt contactless trade, whether that's online, over-the-phone orders, drive-in or contactless exchanges. Ultimately, we do want commerce to start up again, but we need to reduce down face-to-face contact still at alert level 3 as much as we can. Our hope, though, is to not be there too long. Okay, thank you, everyone.
The 25th of April is a significant day, a day of remembrance and reflection. Might it have been just as significant, but for a different reason? Might it have been indeed a day